Our mission at the University of New Mexico is to try to keep PAs in rural practice for rural and underserved practices and the mission of primary care.
They're very important to the patient-centered medical home and being able to provide the vital preventative health measures and to be able to see people in an acute situation.
It is so rewarding being able to help them. I know it's about medicine, but it's more than that. And I think that's part of what the foundation of being a PA is that it's building that relationship with the patient.
As far as being associated with an academic health center, University of New Mexico is ranked #2 in the nation for training medical students in rural care.
The way they go about training their physician's assistants are very hands-on. It was a great experience.
I think you could go anywhere and get certain types of book learning, but our programs, they start with a clinical mindset from the very beginning. The preparation is on seeing patients, bottom line, and I can definitely honestly say that the program's not easy, but it's definitely worth it.
The School of Medicine affiliation appealed to me. I would be getting to learn the same things as the medical students with all the lectures. I'd be able to study the cadavers, actually cut and dissect and learn the anatomy of the human body. And at first that was great, but now I'm realizing it's even better with the affiliation with the medical school because as I've progressed, I've become to know the medical students more on a personal level, and they've also become to know the PA students as well. And in doing that, I've been able to show kind of what a physician assistant is capable of.
It is all-consuming time-wise, and I think it's extremely important for anybody interested in applying to PA school to realize that they're really going to have to dedicate 27 months of their life to the program. You know, it's a real shift because it is so intense.
I had no idea what I was walking into. It's very rigorous. I never thought that in 1 year I would have learned as much as I have now. I mean, I appreciate everything the program has, and they even make up additional lectures for us so that if we aren't really understanding a concept, that someone will come in and teach us what we need to know.
I mean, it was hard and it was rigorous, but it's what you want to do, so you really wanted to learn.
Students both can go to University Hospital and rotate through a very busy surgery clinic, and then maybe the next month they're out in rural New Mexico one-on-one with a preceptor and patients, and so that variety of experience is really critical.
Once you get into your clerkships, you start seeing all the hard work you've put in for the last 2 years start paying off.
Our program is fortunate. We attract very, very strong applicants, and our graduates have a very good time of finding not only a first job, but typically a job that they truly love down the line.
Your classmates become your family for 2.5 years.
You have more siblings than you thought you had.
I don't think I would have been able to get through school without those bonds.
They're 17 of my best friends, so.
The physician assistant faculty really live and breathe the job. They are physician assistants first and foremost. They're strong clinicians. They love being physician assistants, and they love teaching. So the strength of our faculty is a clear strength of the program, and our staff is wonderful.
The student-to-teacher ratio is extremely good. 17 students appealed to me in that just a more personal connection with my teacher.
I've lived the vast majority of my life in New Mexico, which is an absolutely beautiful state. Lots to do, sunshine most of the time, lots of outdoor activities. It's great climate, cost of living is affordable. I think it's a very attractive state to work in, and the need is there.
I grew up here and I really love being home, and I want to take care of the people at home.
If you really are interested in taking care of patients, your dedication to healthcare, and you are interested in this program, I would apply, and if you get accepted, you're going to make it.
I think being a PA is a big responsibility. It's a privilege, and it's an honor.
Use your dedication to patients as your drive.